You may ask, how am I going to take control of my pain? I've had this pain for such a long time. We're going to talk a little bit about spinal cord stimulation, and that is how many of my patients take control of their chronic neuropathic pain. So what is spinal cord stimulation? Spinal cord stimulation is a technology that allows us to trick the brain into thinking that there is no pain, or perhaps less pain. It provides a pleasant sensation to the nerves of the spine, which then allows control of pain in extremities, so in the legs and feet, even in the lower back, and if one has chronic neck and arm pain, one can actually stimulate and get complete coverage of the extremity. What I like about spinal cord stimulation is it provides instant relief, and the patient has complete control. So here at Performance Spine and Sports Medicine, I talk a lot about the test drive. This is the trial portion of the spinal cord stimulation procedure. The procedure itself is a two-staged procedure. It's one of the only surgical procedures that allows you to test it out first, and that's done here at Performance Spine and Sports Medicine. So it's performed right here in the office. The electrode leads are implanted in the epidural space of the spine. It's done under local anesthesia. You don't feel anything as we put it in. And then essentially the device is programmed to control your pain, and the test drive begins. You get to wear that device for several days, and then it's removed. And the beauty is there's no commitment. Once it's removed, it's out. And if it works for you, it can be done on a permanent basis. Here is an image of the electrodes that are implanted during the test drive. As you can see, they're very small, about the size of a cooked spaghetti noodle. I typically will implant 2 leads in the epidural space. Again, very easily done and very comfortable. This is the stimulator. This is the device that is programmed by the technician to provide that pain relief. This is worn on the side. There's a little belt that you get, and that's simply worn on the side during the test drive. For the permanent procedure, everything is implanted under the skin, and nothing is cosmetically altering. Next is the remote control. This is the patient remote control. This allows you to program the device, allows you to turn it off when you want it off, allows you to turn it on when you want it on, and up and down, changing programs. Again, the patient has complete control over the system. So I want to talk a little bit about a comparison between chronic pain medication and spinal cord stimulation, because as many patients with chronic pain tend to be on chronic pain medications, I'm introducing a technology that may allow for a reduction in that pain, and for some patients, complete elimination of that pain medication. So we'll talk first about chronic pain medication. Most chronic pain medications have side effects, most commonly constipation, euphoria, altered mental status. Any pill that you take has to take time to kick in. So that can be very frustrating for someone who has chronic pain with intermittent breakthrough pain. When you take that tablet, you're still suffering for 45 minutes to an hour for that medication to kick in. All opiate medications require monthly visits to the medical doctor, which can be time-consuming and frustrating. Most chronic pain physicians will require routine urine drug screen monitoring, which can get costly, and certainly it's a bit of a nuisance for the patients as well. There is a stigma associated with taking opiate medications, a stigma when you walk into the pharmacy, a stigma when others find out that you're taking these medicines. Certain jobs don't allow for opiate medication to be taken. High cost, not just for insurance companies, but for patients. Every time you fill that prescription at the pharmacy, you're paying that copay, and that can get into the hundreds of dollars per month. And medications can be harmful to the kidneys or liver, and as you know from many celebrities, and it happens in regular folks as well, these medications can be potentially deadly, particularly when combined with other medications like sleeping pills. So now let's transition over to spinal cord stimulation, an alternative treatment for chronic neuropathic pain. There are no side effects with stimulation. It provides instant relief. When you turn it on, it's on. There are only occasional doctor visits, and that's typically just to reprogram the device, which is necessary from time to time. There's no urine drug screen monitoring because you're not taking a medication. There is very little to no stigma associated with this, as no one would even know that you have it except when you walk through security at the airport. There are no medication copays with this device. There's no effect on the kidney or liver, and there are no reports of death from spinal cord stimulation. Now you may be asking yourself, I had back surgery and now I have pain again. Can't I just have back surgery again? And I'm going to tell you why that probably is not a good idea. North and colleagues, North is a doctor who in 1995 showed a statistically significant difference in his patient population that had spinal cord stimulation versus the population that had a reoperation, a repeat back surgery. Found that patients with spinal cord stimulation actually did better than those who had reoperation. So in conclusion, don't have another back surgery. Again, in 2005, North again published in the Journal of Neurosurgery. Now keep in mind, this is a surgical journal where he proved he had a trial of 50 patients with a 3-year follow-up and found again that spinal cord stimulation was better than reoperation. In fact, those patients who had surgery needed more pain medication than those who had spinal cord stimulation. And more patients who had surgery later required spinal cord stimulation to control their pain. So again, in conclusion, spinal cord stimulation is better than reoperation. So just to conclude and to recap, neuropathic pain is a debilitating, ill-defined type of chronic pain, causes a lot of disability. Spinal cord stimulation is one of the options to treat chronic neuropathic pain. And most patients with chronic neuropathic pain are candidates for that technology. Spinal cord stimulation is superior to reoperation in patients who've had prior back surgery. There are no significant side effects with spinal cord stimulation, and you have absolutely nothing to lose but your pain. Again, thank you for joining us on this episode of Solutions for Treating Your Chronic Pain. I'm going to give you some contact information as far as how you can get more information on spinal cord stimulation. You can certainly schedule an appointment to meet with me personally, or you can go to controlyourpain.com. Thank you.